Have you ever wondered if the small changes in the health or behavior of your elderly loved ones are more than just the effects of aging? Often the signs that an elderly person is approaching their final year of life are so subtle that we overlook them. In this video, we will discuss 5 key signs that may indicate an elderly person is nearing the end of their life. While these signs may seem insignificant at first, they are warnings that should not be ignored. It's common to think that death in old age comes suddenly, but the reality is that the body begins to send subtle signals months or even a year before the end. These signs are like little messages the body sends us, alerting us that something important is changing. The problem is that we often don't recognize them or attribute them to the natural aging process. By the time we realize what's happening, it's often too late and we are left surprised by the situation. This is why it is crucial to pay attention to these early signs, as they allow us to be emotionally and physically prepared for what lies ahead. It's not about living in fear or anxiety, but being aware of what may happen so we can offer the best care and love to our loved ones during their final days. Recognizing these signs early will give you the opportunity to create meaningful and comforting moments, as well as make important decisions that improve their quality of life. If this topic interests you, don't forget to like the video and subscribe to the channel. Your support helps us continue creating content that can be helpful to you and many others. Also, if you feel identified with what we discuss in this video or have any experiences you'd like to share, feel free to leave a comment below. We'd love to hear your thoughts and answer all your questions. Stay with us until the end of the video because recognizing these signs can make a huge difference in your loved one's life and yours. Sign 1. Significant weight loss. One of the most evident signs that an elderly person might be approaching their final year of life is significant weight loss. At first, this might seem like something that goes unnoticed, like a belt that needs to be tightened or clothes that start to fit more loosely. However, upon closer inspection, this weight loss is not just a superficial change, but an important sign that something is happening inside the body. The aging process affects the body's ability to absorb nutrients efficiently. As people age, their digestive system doesn't function as effectively, which leads to an inability to process food optimally. As a result, the person starts losing weight without making any conscious effort to do so. This phenomenon is not just about appearance, it is the body's warning that something deeper is going on. In many cases, this weight loss is accompanied by a decrease in muscle mass, a phenomenon known as sarcopenia. Muscles, which are essential for mobility and strength, begin to deteriorate more quickly when the body isn't receiving enough nutrients to maintain them. This can make even simple tasks like walking, getting out of a chair, or even dressing become daily challenges. Additionally, the lack of muscle mass weakens the immune system, increasing the vulnerability to infections and other illnesses. Another important factor contributing to weight loss in the elderly is loss of appetite. The loss of appetite is not just a matter of taste or personal preference. As the body ages, it begins producing fewer of the hormones responsible for stimulating hunger. As a result, elderly individuals often lose interest in food, even if they don't have trouble chewing or digesting. Food, which used to be a source of pleasure, no longer appeals to them the way it once did. This can lead to eating less, which in turn leads to weight loss. In addition to these physiological changes, emotional health plays an important role in weight loss. Elderly individuals going through periods of depression or emotional isolation may see a reduced desire to eat. The emotional stress and sadness can decrease saliva production and make food less appealing, further aggravating weight loss. It is important to mention that weight loss in older adults can also be linked to underlying illnesses. Conditions such as cancer, heart failure, or kidney disease can lead to significant weight loss, even if the person is still eating regularly. In some cases, health problems like dementia or cognitive decline can also influence the lack of interest in food. Practical tips. If you notice that your loved one is losing weight inexplicably, the first thing you should do is make sure they're eating enough. Although appetite loss is common, it's essential to offer small, frequent meals. Instead of forcing large portions, try giving them options that are easy to digest and rich in nutrients, such as protein shakes, soups, or soft foods. Instead of pressuring them to eat more, it's more important to focus on the quality of the food. Calorie and protein-rich foods, even in small quantities, can make a big difference. It's also helpful to include foods that are easy to chew and digest, which can help the person feel more comfortable during meals. If weight loss continues despite your efforts, it's advisable to consult with a doctor or nutritionist to adjust the diet and ensure that your loved one is getting the essential nutrients. Additionally, it's important to be understanding and not press them to eat more than they're willing to, as this can cause them more stress. Sign 2. Extreme fatigue and weakness. Extreme fatigue is one of the most common and often most visible signs that an elderly person may be approaching their final year of life. But this fatigue isn't just the usual tiredness after a long day, it's a deep and persistent exhaustion that doesn't go away with rest. Elderly individuals who go through this phase may begin to experience generalized weakness, making even the simplest activities a challenge, such as getting out of bed, walking around the house, or even sitting down in a chair. What sets this fatigue apart from the tiredness we experience after a sleepless night or stress is its persistence and depth. It's not just being tired at the end of the day, it's a constant feeling of exhaustion that affects all areas of life. The fatigue can become so intense that even daily tasks such as dressing, eating, or having a conversation may feel like monumental efforts. This is due to a combination of biological and physical factors related to aging. As elderly individuals age, their organs and metabolic systems begin to decline in efficiency. The heart doesn't pump blood as effectively and blood circulation weakens, meaning that muscles and other tissues no longer receive the oxygen and nutrients they need to stay active. This reduces the body's ability to generate energy, which explains why even the simplest activities feel extremely draining. The metabolism of energy is also affected. Instead of using energy to perform everyday tasks, the body begins to conserve energy, prioritizing the preservation of vital functions. This means that instead of using energy to move the body or engage in physical work, the body focuses on maintaining essential functions, leaving the person with little energy for other activities. In addition, fatigue not only affects the muscles and circulatory system, but it also impacts the nervous system. Mental energy depletion is another common consequence, as elderly individuals may experience difficulty staying alert or concentrating for extended periods of time. Mental fatigue can lead to confusion, difficulty making decisions, or even daytime sleepiness. The muscle weakness that accompanies extreme fatigue is another significant sign. Muscles which already deteriorate with age lose strength quickly when not used regularly. This creates a cycle of inactivity where the person avoids moving due to weakness, which only worsens the condition. As a result, the person starts losing more muscle mass, which increases the likelihood of falls and other mobility problems. Practical tips. If you notice that your loved one is constantly fatigued and weak, it's important not to insist on them doing activities they used to do easily. Extreme fatigue is not something that can be overcome simply with effort, and forcing a person to move more will only make their condition worse. Instead, the key is to allow them to rest as much as they need without pressure. Create a relaxed and comfortable environment in their space. Make sure they have easy access to everything they need, such as water, food, and personal items, to avoid them having to move constantly. It's also important to encourage rest periods during the day, allowing them to take naps or longer breaks to avoid exhaustion. Sometimes, small changes in the daily routine can make a big difference. Instead of doing tasks for long periods, break activities into shorter intervals with lower impact. Also, make sure they stay hydrated and receive nutrient-rich foods, even if the portions are small. Sign 3. Cognitive confusion or emotional withdrawal. One of the most noticeable changes that can occur when an elderly person approaches the end of their life is cognitive decline or emotional withdrawal. Often these changes can be difficult to identify at first, but over time they become more pronounced. Elderly individuals may experience a decline in their ability to remember, recognize their loved ones, or even perform tasks they previously found easy. This cognitive confusion can be a sign that their body is beginning to prepare for the end of life. Memory loss is one of the first signs of cognitive confusion. This can begin subtly, such as forgetting names, dates, or even familiar places. It may seem like the person has occasional memory lapses, or they may find themselves repeating the same questions or stories over and over. As cognitive decline progresses, these memory issues become more evident and significantly affect daily life. In addition to memory loss, elderly individuals commonly experience temporal and spatial disorientation. For example, they may lose track of the day of the week, the season of the year, or even forget where they are in a familiar place. This type of disorientation can be confusing and distressing for both the person and their loved ones. In some cases, confusion can be so severe that the person no longer recognizes close family members, friends, or even their own home. As cognitive decline advances, the person may begin to experience difficulties in making decisions. Everyday choices, such as deciding what clothes to wear or what to eat, can become a challenge. This inability to make decisions can be frustrating for both the person and the caregivers, as it becomes difficult for them to handle even the simplest tasks. Emotional withdrawal is another key symptom that often accompanies cognitive confusion. Elderly individuals who are nearing the end of their life may begin to emotionally isolate themselves. Activities that once brought them joy, like spending time with family or enjoying their hobbies, may become less appealing. The person may prefer solitude and avoid social interaction. This doesn't necessarily mean they no longer care for their loved ones. Rather, due to the decline in their brain, their ability to process and respond emotionally diminishes. This emotional withdrawal can also manifest as mood changes. Some individuals may become more irritable, while others may become more apathetic or indifferent to what's happening around them. These behavioral changes can be hard to understand for family members, as they may not recognize the person they once knew. It's important to remember that these changes are a natural part of the aging process and should not be taken personally. Practical tips. If you notice that your loved one is experiencing cognitive confusion or emotional withdrawal, the most important thing is to stay calm and be patient. Don't try to constantly correct them or force them to remember something. Instead, try to maintain a calm and familiar environment. Visual reminders, such as photos or meaningful objects, can help them feel more connected to their surroundings. Also, it's essential to respect their wishes if they prefer to be alone or don't want to interact with others. While it can be painful to see a loved one emotionally withdraw, it's important to allow them to retreat when needed without forcing them to participate in social activities. Quiet companionship, rather than pressure to engage, can be much more comforting. If the symptoms worsen or the person shows signs of distress due to cognitive confusion, it is advisable to consult a doctor. A healthcare professional can offer guidance on how to manage the situation and help identify any underlying issues, such as depression or a more severe cognitive disorder which may require treatment. Sign 4. Frequent infections and slow healing. As an elderly person approaches the end of their life, one of the most noticeable changes is the weakening of the immune system. This can manifest in an unusual frequency of infections or slower healing of wounds. What were once minor colds or superficial cuts that healed quickly now may become persistent problems that take much longer to resolve. The reason for this is that, with aging, the body loses some of its ability to efficiently fight infections. White blood cells, which are responsible for defending the body against pathogens, decrease in their ability to respond, leaving the person more vulnerable to viruses and bacteria. Infections that were once easily treated can extend and complicate much more in elderly individuals. One of the most common infections in older adults is pneumonia. Due to the weakening of the respiratory system, the lungs become more susceptible to bacterial infections, leading to pneumonia. Another frequent infection is urinary tract infections, or UTIs, which can be harder to detect in older adults due to the absence of clear symptoms. Skin infections, such as pressure ulcers, can also be a constant problem, especially in people who are less mobile or spend much time in bed. In addition to infections, wound healing becomes much slower in the final years of life. Elderly individuals may notice that scratches, cuts, and bruises take much longer to heal than before. Blood circulation decreases with age, meaning nutrients and oxygen are not efficiently transported to the damaged areas of the body. This makes the healing process much longer, increasing the risk of complications such as secondary infections. The lack of mobility can also contribute to poor circulation and slow healing. Elderly individuals who spend a lot of time in bed or a wheelchair are prone to developing pressure ulcers, open wounds in the skin that do not heal properly. These ulcers can be very painful and difficult to treat, further affecting the individual's quality of life. Additionally, when an elderly person begins to experience recurrent infections, antibiotic treatment may become less effective. Medications that once helped fight these infections may take longer to work, and some microorganisms may become resistant to antibiotics, further complicating the healing process. Practical tips. If you notice that your loved one is suffering from frequent infections or wounds that do not heal well, the first thing you should do is make sure they receive proper medical attention. Recurrent infections should be evaluated by a healthcare professional to ensure the right treatment is being used. Sometimes a change in medication or the use of more specific antibiotics may be necessary. One of the best ways to prevent infections in elderly individuals is to ensure they maintain good personal hygiene. Helping them stay clean and dry, especially in sensitive areas like the skin around the genitals or skin folds, can significantly reduce the risk of infections. It's also important to monitor wounds and pressure ulcers, as they can become very serious if not treated properly. Make sure the person moves regularly to avoid constant pressure on the same area of the body. If the person is bedridden or in a chair, use special cushions or pillows to distribute their weight and prevent the formation of ulcers. Proper hydration and a balanced diet are also crucial for maintaining a strong immune system and aiding in wound healing. If the person has difficulty eating or drinking enough, offering small, frequent bites or nutritious drinks can be helpful. Finally, while the tendency may be to seek aggressive medical treatments, it's important to consider a focus on comfort. In many cases, the priority will not be to completely eradicate infections, but to maintain the quality of life. This could involve using pain management medications and adjusting the environment to ensure the person feels as calm and comfortable as possible. Sign 5. Changes in breathing and circulation. One of the most noticeable changes in elderly individuals who are nearing the end of their life is the decline in breathing and blood circulation. These changes are a natural part of the aging process and often occur gradually. However, when they become more pronounced, they can be clear signs that the body is preparing for its final transition. One of the first signs that breathing is changing is irregular breathing patterns. As an elderly person approaches the end of their life, it's common for their breathing to become more shallow or slower. In some cases, they may pause between breaths, which can be alarming if you're not prepared for it. These changes are due to the decreased efficiency of the respiratory system as the body stops functioning at full capacity. A specific pattern that can occur is known as Cheyne-Stokes respiration. This pattern involves alternating between rapid, deep breaths followed by periods of apnea, a temporary cessation of breathing for a short duration. While this may seem concerning, it is often simply the body adjusting to its minimal oxygen needs during its final stage. In addition to irregular breathing, another clear sign is the reduced circulation. As the heart loses its ability to pump blood effectively, it's common for extremities such as the hands, feet, or even the ears to become cold. This happens because the body begins to prioritize blood flow to vital organs, such as the brain and heart, and reduces circulation to the extremities. This is a clear sign that the body is starting to slow down, a natural process in the final stages of life. The skin can also change with decreased circulation. It may become more pale or develop a bluish tint, especially around the nails or fingers and toes. This change is known as cyanosis and occurs because blood is no longer being efficiently distributed throughout the body. The lack of circulation can also lead to a sensation of coldness in the skin, which may make the person feel uncomfortable. As circulation continues to decrease, individuals may experience difficulty breathing, even with minimal activity. Simply talking or moving across the room may result in a sensation of shortness of breath or a feeling that they have to make an effort to breathe. This difficulty in breathing is a clear sign that the lungs and cardiovascular system are losing their effectiveness. Practical tips. If you notice that your loved one is showing signs of irregular breathing or changes in circulation, it's important to stay calm and create an environment that is as comfortable and relaxing as possible. There's no need to intervene or try to correct the breathing pattern. Instead, the best thing to do is ensure that the person is in a comfortable position for breathing, such as sitting up or reclining with pillows to avoid feeling suffocated or uncomfortable. Keeping the environment cool can also help alleviate some of the discomfort caused by breathing difficulties. You can use a fan or open windows to ensure good air circulation, always adjusting to the person's preferences. Avoiding an environment that is too hot or stuffy will make them feel more at ease. If the person starts to feel short of breath, you can offer small sips of water or even supplemental oxygen if necessary and recommended by the doctor. However, the most important thing is to be there for them, offering emotional support and not trying to correct the situation in an overwhelming way. End-of-life care should focus on alleviating suffering and providing a peaceful, tranquil environment. Signs of irregular breathing and changes in circulation should not be seen as something that needs to be fixed, but as a natural part of the aging process. What matters most at this stage is that the person feels comfortable and surrounded by love and support. In this video, we've discussed 5 key signs that may indicate that an elderly person is in their final year of life. Significant weight loss, extreme fatigue, cognitive confusion, frequent infections, and changes in breathing and circulation. While these signs may seem small at first, they are important indicators that the body is beginning to decline. Recognizing these signs early can help us prepare emotionally and offer the best possible care. By being aware of these changes, we can make informed decisions to ensure our loved ones live their final days with dignity and comfort, surrounded by love and support. It's important to remember that each person experiences aging and death in their own unique way. These signs are not something we can prevent or avoid, but we can make their final moments as comfortable and meaningful as possible. The key is to act with compassion, patience, and presence. If you found this video helpful, feel free to like, leave a comment, or subscribe to the channel. Your support helps us continue creating valuable content for you and others who might be going through similar situations. Thank you for watching this video. We'll see you in the next one.